All right, definitely the program this morning on ITV on independent television. Yeah, we've got the Honorable Commissioner of Health at Edo State now talking about Mr. Samuel Ali. And we're going to be looking at the fight against medical quackery in Nigeria, an age-long problem you may want to say. So welcome to this program this morning on ITV.
Good morning. Thank you very much.
Okay. All right, so let's start from what is really going on in the medical profession in Nigeria as it relates to quackery. One is tempted to want to know, or to want to ask also, is it that government does not have the will, or they don't want to do anything? Because it looks as if there seems to be this complacency. Government seems to be complacent, to take the fight against quackery in the medical profession.
No, it's not as if government is complacent. I think Governor Obaseki is one whose priority has been health, education, health, among other in his government. And so he has been the forefront of saying, look, let's regulate what we're doing in the medical space. And many times he even tells me, even if there's a government hospital that is not meeting up to standard, apply same sanction. So he's one person who is very passionate that we should operate at the level in which that is the standard that is obtainable in the world. And we have no reason to be operating in the way that has been the norm for so many years. Maybe because past administrations have not had health as their focus, and they don't really understand what healthcare means. A lot of politicians just think healthcare is building hospitals, providing infrastructure, and then they go away. But healthcare is more than that. We want to be sure that the citizens are getting the right treatment at every point of the healthcare system. And so government cannot treat everyone. Government hospitals cannot treat everyone. And so those who have decided to engage in private practice, it is now the duty of government to make sure that they adhere to the minimum medical standards. And that is exactly what we have been doing in those states.
Okay. Now, let us be careful so that we don't restrict our discussion this morning on the orthodox health care delivery. We've got the traditional healthcare delivery too. Now, if you take a look into the dictionary, a quack is somebody that is not supposed to do what he does. We've got the traditional medical, providers. Now, you people in the orthodox medical profession, you refer to them as quacks, those that provide the traditional medicine and all that. Now, these people, they are in the States. They abound in Nigeria everywhere. And most governments in the country, they are aware of them. But somehow you still refer to them as quacks. That was why I started by asking. There seems to be a complacency. It looks as if that government is complacent. Is it that government is not aware that these people are quacks in the medical profession, as it were?
They are quacks because they are operating beyond their boundaries.
So what is government doing?
Let me just say this. They are quacks because they are operating beyond their boundaries. If they stick to what they are supposed to be doing, then they are no longer quacks. Just yesterday, I had a meeting with the Integrative Medicine Association, which is an umbrella body of all those that practice alternative and traditional medicine.
Yeah.
And one of the things I told them clearly was that they should learn to practice within their confines.
What do you mean
within their boundaries?
What is there
for
within
instance,
confines now? Yeah.
Why should a naturopathy, if you are a naturopathist, why should you admit a patient and maybe want to perform surgery, you want to give injection, you want to give drip, you want to treat malaria? That's quackery. You're already practicing quackery. Do you get it? So, and I made it clear to them. I said, so the days of just looking at what government fold his hand and maybe because people are not interested in what you are doing and all of that is over. So I need to speak to the association so that they can also speak to their members, So we have engaged, we should not just limit it to just, quackery is not just limited to the alternative or traditional herbal practices. It's abound everywhere. There are nursing homes which are run by nurses and they perform surgeries, which they are not supposed to do. You are in a nursing home, you are supposed to just practice within the scope. There's a guideline of what you should do in a nursing home.
Let us
so that's also quackery. If you are operating, if I go to a lab, if you go to a lab has space for admitting patient, giving stabilizing patient, giving drips or treating for malaria. That is quackery also, because he's not supposed to do it.
Okay, as it stands now.
So we should not think of quackery only in terms of the alternative medical practice. But I'm saying that quackery abound in almost all phases of the medical practice itself.
Now, as it stands now in Edo State, which one is more problematic? Is it those that are not licensed?
All of them are. Let me, this last week Monday, I had a press conference about the status of regulating our providers. And before this, I've had meetings with different associations: Nigerian Medical Association, Association of General Private Medical Practitioners, the Nigerian Nurses and Midwives, Pharmacy Council, Patent Medicine Store Association. All of these, I've held meetings with them in different times, all along, just to let them know that, look, we are going to be strong on this, and we are not going to continue to go the way we are doing. And so the focus has been to regulate everyone, and not just one particular segment as if we are witch hunting someone. No. So, and the good thing is that the Ministry of Health has every cadre of staff that is knowledgeable or that is an expert in each of these areas. We have someone who is a pharmacist, but who is also has had training in alternative medical practice, and she has the traditional medicine.
Who licensed the alternative medicine provider? Is it your ministry of the government?
No, there's a traditional medicine board.
Okay.
There's a traditional medicine board.
Okay.
You see, and that's why let's not demonize one particular. They have a role.
Yeah,
they have a role, but they must know that they must be confined to their role.
We need to be careful, because a lot of persons are not too comfortable with some of this alternative healthcare, service delivery. I mean, imagine somebody that has not gone to he's not a surgeon. He didn't get the normal training of being a surgeon. Then, of course, he goes around and he says that he's a surgeon just because he can do one or two.
That is exactly what I've said.
Yeah,
that's operating beyond your scope.
Okay.
And that is extending beyond your boundaries.
And a lot of them.
So, if you are not a surgeon, you have no right to touch someone. And I don't want to disclose all the details I had in the meeting with the traditional people, traditional medicine or alternative medical practitioners association yesterday. But I made it clear to them that they cannot be practicing beyond their scope. If you are in naturopathy, you should stick to it. Do you get it? And then you don't have right to, maybe a doctor has said this woman should come for surgery, and then she comes to meet you, say, oh, I have one drug that I can give you, and you don't need to go for such surgery. You should not do that. You should encourage that person, go and do your surgery. After your surgery, drugs might still help you, because most alternative herbal medicine are not curative. They are just preventive, or at the best a maintenance therapy. But most times people confuse it to me like, oh, and I was giving the example of a lady that was supposed to do a brain surgery because she has a tumor, and then she didn't go because one person told her she can take herb and it will disappear, and she took the herb for one month, and she collapsed, and then they have to rush her and still carry out the surgery. You see, that is what we are against. That is what we want to say, and that is what we are trying to say. Look, you must not practice beyond your scope. You must know what you are supposed to do, and you must stay within that confine. You get it? Quackery is when you are not qualified to do something and you are doing it. Okay. That's quackery.
All right. So recently, the Edo State government now, through your ministry, had to seal about 108 medical facilities in the state. Now, for most people, that is perhaps coming, too late. They somehow say that this would have been done much more earlier than this. I mean, for a government that is on the verge of leaving.
No, government is a government is a continuum. Yeah, which one is government that is about to leave?
It's a good step.
It's always. Let me also say this. Yeah. They said maybe the best time to plant a tree was 10 years ago.
10 years ago.
But now that you know, what will you do? Start planting the tree now. Do you get it? So don't waste any time, and then just planting the tree, and then that in another few years that tree will come. So government is a continuum, And it's not that he's doing it, he's just doing it. It has been part of what he wants to do. Maybe there had not been, the governor always have what he wants to do. And then it is now left for the commissioner to actualize those policies. So maybe that's what has been happening. It's not new. It's what he has wanted to do from day one. It's not new. And the fact that it's not done does not mean that, or it's been done now, it does not mean he has never wanted to do it from day one. In fact, you could even say, why is he doing it now when elections are closer? Because it should be a minus to him. But he's not looking at that. He's just looking at the fact that the safety of the people is more important. And we should learn to do something properly. And we should learn to do the right thing and do it properly. Okay. And that's what he's doing. The government is a continuum. I believe his successor will also definitely still key in. And then within a short time, everybody now know that you should not do this and you should do what you should do.
Let's talk more on the sealed health facilities now. Now, what's where the yardstick now? Is it that the number, the kind of number of staff that those facilities have, or the kind of doctors that they have there?
No. There were four major criteria.
Okay.
One is if you are not registered. We all know that. I mean, it's normal for you. You are operating this ITV now. Are you not registered? You are registered. You are licensed to do this. Yeah. Do you start off doing it and then you now register or license? No, you get your license first. In fact, even if you have this building, you get your license and all. They come, they check, they see everything okay, and then they license you, and that's when you start going on air. And that is what happens. Your car, when you get a car, you can't just be driving the car. You go and register it with the government, get a license plate, and then you start driving. And you can show any officer of the law that these are the papers, this is what qualify you to. It's not just for you to even have that license. That you who is driving that car, that are also licensed to even drive the car. It's the same thing with medical facilities, whether it's laboratory, whether it's hospitals, clinics, eye centers, pharmacy, anything. You must first seek approval from the Ministry of Health and say, look, I want to establish, because we need to know where you are. And we also need to know who owns it or who is going to be working there. So all of those things are what we come to. And if it meets the minimum requirement for what you want to do. And so these are just normal. They are not, it's just that we have not, like you said, we have not been enforcing it. But now we have to be doing what is right.
Okay. Now, I little wonder whether your own ministry is aware of what is going on now. Most, clinics, that's what they go by now. Somebody has a two-bedroom apartment, he turns it into a clinic, and you have some young ladies that go through some apprenticeship in nursing. What is going on?
Yeah, okay. So I was mentioning I was giving you the indicators for sealing of those facilities. So I think I get. So one is when a facility is not registered, practicing beyond your scope, which is what we've discussed earlier. And then the third one is use of unqualified professionals or unqualified people, staff, which is just what we are saying now. And then thirdly is unsafe medical practices. The fourth one, unsafe medical practices, such as we've gone to some hospitals and they have expired drugs. They have expired drugs. The environment is not just good enough. The environment is, the waste disposal system is unsafe. And so the hospital should be one of the cleanest places. The hospital should be one of the cleanest places in any environment. But sometimes you go to a hospital and you begin to wonder, what's going on here? Is this a dustbin? The medical waste disposal are not properly done. There's a way you dispose medical waste. You cannot dispose medical waste just as you do in your normal house. No, because they are hazardous. And so people must know all of this. And some people know, and maybe because, like you said, government has not been allowed to its responsibility, anything goes. Some people are just ignorant of it. But like you said, you go to a hospital also, it has a two-bedroom. No, we are also shorting, we are also very particular, if you want to set up a hospital, it has to be in a proper place. And it has to meet certain requirements. People cannot, we have been to a so-called hospital, even it was a 3-bedroom flat or a 4-bedroom flat. And one of the rooms, people are living there.
And even at times
people are living there, and he said, "This is." And we said, "No, we cannot take this. Okay, you have to shut down."
They
this.
do surgery.
Do you get it? Some people are living there, and they are just passing, and he said, "I don't know. I have not seen such," and it was so baffling. So we have to tell him, "Okay, sorry, we will close this place down. You have to go and get another place." Do you get it? So we are trying to establish standard, either because people are ignorant, or they are just taking the laxity that is in the society, and we are not going to continue in that trajectory. We want our people to receive proper care and in the right place by the right personnel. So in the previous years, you just see, and sometimes go to a facility, there's just no one single qualified personnel. The doctor is not there. The people that are there, they are all unqualified. They are not certified, and they call themselves nurses or auxiliary nurses. And we are going to put a stop to all of that. So we are going to back it up by law. We don't want what you call auxiliary, because if you are going to have the so-called auxiliary nurses, they are supposed to be under a qualified nurse.
Or under a qualified nursing facility.
Yeah, yes.
Yeah.
So somebody's supposed to be supervising them and say, okay, this is how you do it. But that is not what you see. So-called auxiliary nurses are everywhere, just treating and practicing quackery all over the place. So we are strong on that, and we are not shifting ground.
Okay,
to
let
make
me
sure that
take your
people
mind back now. A while ago, you mentioned that one of the criteria that people use is when the environment is not clean. Is the government
unsafe medical practice?
The environment not clean too. You said so.
Yeah,
now,
yeah.
Little wonder whether the government is aware. There are allegations now that even the public, health facilities that you have around, maybe some of the state-owned public facilities, there are allegations that the environment at times are not too.
And when we go there, we also close it down temporarily.
You close down the government's facility.
Why can't we do that? Sometimes you have to shut down your own facility to give it a facelift, or until you have the resources to do what it's supposed to do. Sometimes when governments do this, especially to their own facilities, there's a lot of outcry and there's a lot of insinuation, and maybe that's why government is resistant to do it. I remember even if it is not hospital, when the College of Nursing was in a dead state, and the governor went there and closed it, all sorts of things were said. But he renovated it, and then now you can see what it is. But when he closed it down, there were a lot of shouting, a lot of, oh, he has closed down the School of Nursing. He wants to sell it off. And that's what usually happens. And that's why sometimes government is a bit hesitant in doing what is right in the public space. Because if a government go and close down a government hospital, oh, he has closed down this hospital, he wants to shut it down. But sometimes you need to do that because you want to now give it a proper facelift. We are building Stella Obasanjo Hospital, and it has to be closed down because that hospital was in a dead street. It's not something you do patch work. And we want to build something there. But when the governor closed it down, like a year ago or so, what did people say? They said he has sold it. Yes, also. Some said, in fact, I remember somebody said, told me and said, he had governor has sold it to National for them to build orthopedic. I said, really? So some things are so ridiculous when you hear them. And I said, no. But go there now and see that the outpatient department has been modernized, has been rebuilt, and this it can pass for anywhere, any standard, anywhere. Okay. So what I'm trying to say is that sometimes we are a bit hesitant on government public hospital in just closing them down for renovation and all of that because of the outcry that usually comes from it. People will always shout, oh, why is it closed? This is the only hospital that is serving us in this area. Oh, this person has come to now. Where are we going to go now? So all of those considerations are usually what hinder us from totally not. But we are also very strong in trying to say that we that are regulating private, our own too is of standard.
Okay. All right, so viewers out there, in case if you just joined us, the program is this morning on ITV. We're taking a discussion, on the fight against quackery in the medical profession in Nigeria. And Edo State seems to be a major focal point this morning. And we've got the Honorable Commissioner for Health, Edo State, Mr. Samuel Ali, discussing on the challenges and some of the efforts that the Edo State government is making to ensure that it ends quackery in the medical profession in Edo State. Now, Honorable Commissioner, all we've been discussing seems to be happening within the metropole, within Benin City. Let's take it further now. Now, if you go to, let's say you go to a health facility in Uzaire, most doctors there, they don't want to stay there because of the sanitary condition, one, and because of, the standard and all that. Now, this fight against, quackery. And at times, too, we have some of this alternative, medicine provider in all the suburbs. Are you taking a fight to them to outside Benin City?
Yes, sir. we are in the whole of Edo State. But you know that we have more hospitals in the Benin metropolis or in the Benin city itself than any other place. Well, I don't know what you mean by Nuzare if you go there. The government hospital...
I don't want to mention, there are some certain villages in Edo State, maybe in Edo Central, there are some certain towns that they are known for bone. They can help you if you have a broken limb, they can help you and all that. Now, but for most people, they are quacks. Is the government aware of this? Are they looking at them? Are they controlling them at all?
Yes, it's okay. This is what. Let me tell you what we are doing. We have engaged a consultant, and what we are doing is all medical facilities, including the traditional, whether they are bone settler or not, we want to know where everybody is. We want to know them, not just in their location, but what we call mapping, GIS mapping of all of them. And this we have commenced this exercise since late last year, December, and we are hoping that by end of February we should be done with the mapping, and so we will be able to know where everybody is, and we are working through the associations because the associations know almost all of them, and so they are in the best way to say, okay, there's one person hiding here and all of that. So I think the first thing is to even know how many do we have, what do they do, and then we can begin to say, okay.
Is that what you refer to as the GIP mapping, or what do you call it now? GIS mapping?
Yeah, yes.
Yeah.
GIS means that it's just like your Google map. Anywhere you are going, you can. So if you say you have a practice, we can key it into this computer system, into our system, and then it can show us your location. This is just what is obtainable anywhere in the world, and that is what we want to do. We want to make Edo as to operate in that standard that is obtainable elsewhere. All of those traditional bone settlers, we still come to them. We've started the thing. This is not a sprint, it's a marathon, and we are ready to go the long way.
Okay. Now, let's talk about pharmaceuticals now, because there are so many fake drugs in the society. If you're one of those that take some of these public buses, you would have seen one or two persons, trying to introduce you to some of this pharmaceutical. Imagine somebody tells you that, hey, you take this thing, it takes about 10 ailments from your body. Now, the worry, Mr. Samuel, is the fact that at times you see these guys, you find these people in state-owned buses. When I say state-owned buses now, of course, viewers out there will know what I mean. I have, at times, I apply them, and I've seen one or two of them, that what is going on? Is it that the state government is not aware that state-owned buses, you even allow these people come in and they sell these pharmaceuticals to, innocent citizens? Are you aware of this?
Yes, we are aware, and it's part of what we are fighting against. Like I said, most times we go through the association. There's a patent medicine store association, and there's a pharmacy council association. So, there's a pharmacy council, which is what's supposed to regulate whether community pharmacy or patent medicine, all of these people. So we are trying to walk through them to say that they we are able to bring all of this into the. Very soon you will see that all of this selling in the bus will stop. I can assure you.
Even in the public buses?
Public, whether public or private, they are going to stop.
Okay. All right, so let's look at...
It is wrong. You see, like I said, some people are doing it because they are ignorant that what they are doing is wrong. Some people are doing it because they know that they can get away with it. So the first thing in such instances is to ensure that you educate people. You bring enlightenment and you're trying to warn them, look, we won't tolerate this, we won't take this. So you pass your message. The first thing is not just to go and arrest someone. We warn them, and then you give certain period for people to change, and then if they don't comply, then you start using the sledgehammer.
I'm talking about now, we understand that recently you had to give a certain period. What is the period now that you are, the window of opportunity that you are giving to them?
No, like I said, one thing we wanted to do was first, let's even know how many do we have. You know, so it's at the end of our exercise that we will say, okay, at least we know that this is where this person is. So anyone that is not on that, then you have now run short of the law. Like I said, by end of February, early March, by first quarter, all of that will now swung into action proper. But we are taking measures even now, and that is why between August and now, we have seen 108 facilities. But like those ones hawking on the bus and all that, where sometimes it's difficult to get them. Did you get it? So you have to now go through the associations or go through those who and pass the message to them to stop, because it's actually not, it's actually illegal.
When you say it's difficult to get them, now there are allegations too. You know, we in the media, we hear all sort of things. Our responsibility, when we have the opportunity, we don't hold them back. We ask people that's their authority in that field. Now, there are indications, and of course, there are allegations too, that some of these vendors of these, pharmaceuticals in public buses, that they pay revenue to government officials. Is the government aware of this?
No,
I mean, that they give them tickets, at bus stops, at bus
no, I'm not
terminals?
aware. I'm not aware. I'm not aware. I can, maybe after this, I'll find out, but I'm not aware. If they are giving them tickets, maybe to board the bus.
Not to board the bus. I mean, giving them tickets,
to board the
they
bus.
know what they are doing.
No, the government, that is not the way you don't tax people.
When they are not doing the right thing. You don't.
No, you don't. Because that means you have already accepted.
You are aiding and abetting
No,
them.
that means you have accepted what they are doing. If you tax people who are doing the wrong thing, that means you have accepted it. So government cannot tax. And like I said, people take advantage of a lot of things. And so we should not think that because government is supporting it. And I can assure you, some of those people collecting tickets or giving them tickets to get into the bus and preach, they might not even be staff of any government ministry.
Not to give them tickets to get into the bus. They give them, they ask them
That's
to
what I'm
pay
saying. They might not
for
be,
what is, because they are selling those pharmaceuticals.
I can assure you that they are not even staff of government ministries, because people, most staff in the ministry or those who work for government knows that the governor is very averse to corruption or to any forms of hanky-panky games. So I can't see any staff that will be so bold
to carry
out such activity. Usually, these are people that are not government staff. I can assure you. But since you have brought it out, I will also discuss it with the agencies that look at that are responsible for collection of taxes from bus park and all.
Okay. All right. So as we draw conclusion on this discussion this morning, what is your message now? I want you to look straight into that camera and let Edo people know that it is not business as usual. That the government of Edo State is really against medical quackery in the states. And of course, look into the camera and let the people know.
Okay. Our message is that we are not out to witch hunt. We are out to ensure that our citizens are treated in the way that they should be treated, that people receive adequate, safe care at approved and designated facilities. Our regulation is to ensure the safety of the citizens, and so people should embrace it and cooperate with government by exposing those quacks within their midst, because sometimes we citizens will also aid and abet all of these things. So it's good when people are informed, they know that it is for their own safety. We want people to be safe. A lot of people lose their life or sudden death and all of that from all these kind of quackery practice. So we are regulating them so that people, the citizens of Edo State or residents of Edo State will be safe at any point in time in the medical space.
And of course, that the government of Edo State should continue to improve on health facilities too.
Yes, we are doing that. We are doing just that. I just told you what we are doing in almost all the senatorial zones. The government is doing all of that. We are building primary health care centers. We've built 50, and our target is to ensure that there's one primary health center in each ward, not senatorial ward. In each ward. We have 192 wards in Edo State, in each ward. And so that way, healthcare is closer to the people. You don't have to come to Benin anywhere you are. And we are also making sure that we have mega hospitals that where those primary health care centers cannot treat, they can refer to. And so that's why in Benin Metropolis, we have a Edo Specialist Hospital. And Stella Obasanjo we are building, which will be completed this year. We have the Aochi General Hospital, which serves the Edo North. And then we have also the Uromi General Hospital, which we are upgrading this year. The center already have the federal government's Ira Specialist Hospital, which provide that care for all the residents. But we are also looking at that and doing all of that. So, but sometimes people say, oh, I do specialist hospital, maybe because of the standard, it's too expensive. And that is why we said we have provided health insurance. With health insurance, you can go into Edo Specialist Hospital. And nobody is going to chase you away, because the health insurance is one way to finance health for everyone.
All right, so we want to say a very big thank you because of time factor now, and we understand that you also have to go to work this morning. So we'll let you do that now as we take a stop on this discussion this morning. I want to say a very big thank you for finding time to come on the show.
Thank you very much. Thank you so much.